Are you concerned about the surge on our hospitals?
We have the best of medicine here in Cuyahoga County, but the number of beds are limited. And so this is why it's critically important for people to stay home so that they aren't exposed to the infection, or if they are sick, they don't expose others, which could then further the surge on our hospitals. The curve we continue to talk about has a line of where our hospitals can handle infections. And if there are more than they can handle, particularly intensive care units and ventilators, then we will have a serious problem. And we are trying to avert that before it becomes a surge issue for our hospitals.
What's the difference between isolation and quarantine?
Quarantine is for someone who is not symptomatic, meaning you have no symptoms, but you have been a close contact of someone who does have a case. Isolation is another level of protecting others and yourself. So isolation is for people who are sick, who do have symptoms. And the difference is that in quarantine, you might be in your home. We would ask you to be in your home, but you can freely move about, cook your food, do what you need to do. In isolation, if you're sick in the home, we need you to be alone in a room, ideally using your own bathroom, and not being out and about around other members of your family. You shouldn't be cooking their food. You shouldn't be the one taking care of them if at all possible. We understand that's hard with small children, etc. But isolation is a whole another level of walling yourself off from the rest of your contacts so they don't too become cases.
When or how would I be notified if I may have been exposed?
So if you are a close contact of one of those people who is one of the 130 people who have had a lab confirmed diagnosis of this, if you were identified by that person in our in-depth contact interview as somebody who had close contact with them, you will receive a personal phone call from us or from a health department where you live. We will then explain to you exactly what quarantine means and exactly what symptoms you need to watch out for. If you were in a congregate setting, so you were in a large group setting with someone who was positive, but you weren't, say, for example, sitting at the same table as them, the people at the table would be those close contacts, but others in the room, across the room, wouldn't be a close contact, but we've crafted messaging for those particular organizations so that they can alert people who were in attendance to these. We've done dozens of these over the last few weeks so that people are aware of what to watch for and what their level of risk is. But we are not going to be releasing this particular street, there's someone living with COVID or anything like that, because it's a privacy issue. If you are at high risk for getting this infection, you will have or will hear from us or your local health department. But in general, I want people to understand that there's a very high level of infection in the community.